This is the final video for Nursing 210. First, we are assessing the upper and lower extremities. We start with the upper extremities, looking at color, checking temperature, texture, skin turgor, looking to see if there's any lesions present. Then we look at the lower extremity. Again, looking at color, temperature, texture, skin turgor, looking to see if there's any varicosities or edema. Then we're assessing the nails, looking at the color, shape, condition, looking at capillary refill, looking at the adherence to the nail bed, looking at firmness, thickness. If you could go like that for me, assessing the contour to see and shape to see if there's any pubbing. Next, we assess the head and facial area. So we're looking at the head. We look at the overall shape, size, and symmetry of the head. We're looking at the head, the scalp, hair distribution pattern, texture, quality of the hair, seeing if there's any lesions present. Is there tenderness at all? No. And we're palpating the paranasal sinuses. Assessing cranial nerve number 5, the facial nerve. If you could clench your teeth, push against my hand. Again. Also testing for sensation. This is going to cause you to blink. Can you feel that? Mm-hmm. Can you feel that? Mm-hmm. Then we're testing cranial nerve number 7, the trigeminal nerve. If you could smile, frown, purse your lips, puff out your cheeks, show me your teeth. Okay. Then we're assessing the eyes, starting with cranial nerve number 2, the optic nerve. We're testing for vision. We use the Snellen test, which checks for distance vision. You have them stay 20 feet away from the Snellen chart, and it's documented by 20 over, and how well they can see based off of the line is between 20/20, 20/40. Then you also assess the Rosenbaum test. It's a test that you have to be able to see the number within the circle. Then we assess the peripheral confrontation test for peripheral vision. I'm going to go like this. Let me know when you're able to see it. Now. 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 Okay. And then we're assessing the oculomotor nerves. The third cranial nerve is oculomotor, 4th is trochlear, and then the 6th is abducens. We do that with the 6 cardinal positions of gaze. If you could follow this pen light. Okay, very good. And cover one of your eyes. Look at this finger with keeping your eye on this finger. Take your hand off of your eye and look at this finger with both eyes. Okay? And then we're going to do that again. Cover your left eye. Thank you. And then we're also looking at the corneal light reflex, seeing if there's a twinkle in the eye. Now we're inspecting and palpating the eye. We're looking at the eyelashes, eyebrows, the eyelid, looking at the sclera, pupil, conjunctiva, the iris, looking at the looking at and palpating the lacrimal sac, looking at the position of the globe. Then with the ophthalmoscope, we're going to be inspecting inside the eye. Looking at the retinal background, looking at the retinal vessels, looking at the AV ratio, AV crossing, looking to see if there's any hemorrhaging, looking at the cups, looking at the macula and the fovea centralis. After inspecting the eyes, inspect the nose, looking at the size, shape, and symmetry of the nose. We'll look inside the nose. You lift your head up. Looking at the septum, the mucosa, looking at the turbinate. You could close one nostril and breathe through the other. And then do the same on the other side. Checking for patency. Now you can close your eye and tell me what this smells like. Cranberry. That's assessing cranial nerve number 1, the olfactory nerve. Then we're going to inspect the ears, also with the looking with the otoscope. Looking at the external meatus, looking at the mastoid process, looking at the external ear canal, with the otoscope, looking at the tympanic membrane, looking at the coronal light reflex, looking at the 3 inner bones, the pars tensa, the umba, and the malleus. Also, you check cranial nerve number 8, the acoustic nerve. I'm going to hit this, and it's going to vibrate. Let me know when you don't feel it anymore. No. Okay. And then let me know if you hear it. Let me know when you can stop hearing it. No. Okay. That's checking the weather and Ryan test. I'm going to whisper a word into each ear. Let me know. Repeat back to me what word I'm saying. Liberty. Nursing. That's checking cranial nerve number 8, the acoustic nerve. Now checking the mouth. We're looking at the lips. If you can open your mouth. Looking inside the mouth, looking at the tongue, the buccal mucosa, looking at the teeth. If you could flip your bottom, looking at the ducts. If you could lift up your top lip, looking at the Wharton's and Stenson ducts. If you could open your mouth and point your tongue to the ceiling. Move it backwards. Looking at the sublingual area. Looking at the hard and soft palate. If you could stick your tongue out and say ah, making sure that the uvula vibrates and stays within midline for the glossopharyngeal nerve. The vagus nerve be checked by the gag reflex, and then checking the hypoglossal nerve. If you can stick your tongue out and point it up and down and side to side. Okay, and then now we're assessing the neck area. We're looking at the size, shape, and symmetry of the neck, looking at the trachea, palpating the trachea, assessing the carotid arteries, listening to see if there is a bruit heard, palpating the cervical and the vertebral muscles. If you could turn your head around. That's testing for range of motion. If you could push against my hand again, and then shrug your shoulders upward. That's assessing for cranial nerve 11, the spinal accessory nerve. Then we need to palpate the lymph nodes, palpating the preauricular, postauricular, submandibular, submental, clavicular, posterior, anterior and posterior chains. Assessing also the trachea. Then we move on, assessing the lungs, assessing the anterior and posterior position, checking the shape and symmetry and how the chest moves with respiration, looking at the diameter of the lung. If you could turn around for me. You could breathe in and then exhale. Assessing for thoracic expansion. If you could say 99 each time I move my hands, you'll feel my hands moving like this. 99, 99, 99, 99. That's checking for tactile premises, seeing if there's any vibration. If you could lift your shirt up a little bit. You can breathe in. Breathe in and hold it. And exhale. Now exhale slowly. Checking for diaphragmatic excursion. It's about 3 centimeters. Then we percuss. Lung fields. Now I'm going to take a listen. You can just breathe normally. Okay, if you can turn facing me. We've also been assessing to see if there's any bulges, masses, or lesions. Take a deep breath. And exhale. Again. Breathe normally. Take a deep breath. And exhale. Again. Exhale. Exhale. Now we're assessing the cardiac system, assessing to see if there's any heaves, lifts, or thrusts, palpating for the PMI, and if there's any murmurs. Then we're auscultating the second intercostal space, right of the sternal border, between the aortic calx sound, where S2 should be heard louder than S1. So we move across second intercostal space, left of the sternal border to the pulmonic area. Then the third intercostal space, left of the sternal border, or point, where S1 should be equal in sound to S2. Then we're looking at the tricuspid area. Then we're listening to the mitral area, also known as the apical pulse, PMI. And the fifth intercostal space, where S1 should be heard louder than S2. We're assessing the pulses, checking temporal pulse, brachial, radial. If you could sit up straight. Assessing the popliteal pulses. You would assess the femoral pulses. Check the dorsalis pedis pulses. Posterior tibial pulses. And then we assess the abdomen. You could lay down for me. Looking at the abdomen, looking to see if there's any striae or vascular patterns, looking to see if there's any bulges, masses. Looks like there's any hernias. We're going to auscultate the vowel sounds in all four quadrants. So we're going to auscultate over the spleen, liver, and kidneys to assess if there's any bruits or any friction rubs over the organs. Then we're assessing the iliac, renal, and femoral arteries, assessing to see if there's any bruits. And then the femoral would be down there. Percussing the liver. And the spleen. Palpating the liver. You push up against me. Okay, I'm going to be measuring, so I'm going to be percussing again. Listening will gel or resonant. Measuring. Approximately 4 centimeters. And we're palpating spleen. You can push up against me. And again, palpating the kidneys. You go ahead and sit up for me. Be rotating around the room, checking the environment. If you could go ahead and stand up for me. Assess cerebellar function. If you could walk with your heel to the front part of your toe, couple steps. Okay, and go back. Okay, and then if you could close your eyes, push, see if there's any sway. That's assessing the Romberg test. If you could put your fingers, each tip of your finger to each part of your nose. I'll have to have you do that again. Close your eyes and try to do it again. Okay. And then we're going to be assessing the rapid alternating movement test. If you could put your bottom part of your hand on your lap and then flip back and forth really fast as you can. Okay? And then take the heel of your foot, of your right foot, and rub it down the front part of your other shin. And then do that again. Okay, you can go ahead and sit down. We're going to test the sensory function. We're going to test the stereognosis and graphesthesia. If you could tell me if there's 1 point or 2 points. Okay? Keep your eyes closed. 1, 2, 1, 2, 1, 1, 1, 2. Okay, and now I'm going to draw a number in your hand and let me know what the number is. 8. 7. Okay. And then I'm going to assess your reflexes. Or actually, I'm going to check. If you could tell me if this is sharp or light, so sharp or soft, and where I'm doing it at. Go ahead and close your eyes again. Sharp right here. Okay.
Light right here.
Okay.
Sharp right here. Light right here.
Okay. And now I'm going to be checking the reflexes. Checking. Okay. Check the tricep, bicep, brachioradialis. Check the patellar. Okay. If you could lay down on your stomach with your feet that way. Checking the ankle reflex, if you could push it just scoot down this way more. Okay. You could go ahead and sit up again. We're going to be inspecting strength and range of motion, looking at the alignment, shape, contour of each joint, muscle. You want to go ahead and stand back up for me? We're going to start with the neck. So follow me as I'm doing it. Forward flexion, backward hyperextension, and then lateral to each shoulder, and then rotate it around. Then I'm going to be checking the strength of your neck. If you can push against my hand, again, push with your forehead, and then push with the back of your head. Now we're checking shoulder range of motion, forward, hyperextension, and then we're going to adduct and abduct, and rotate forward, and then rotate backwards. Can you do the same on the other shoulder? Out, hyperextension, adduction, abduction, rotate forward, and rotate backward. Okay, now we're going to assess the strength of the shoulders by checking the biceps and triceps. Pull against my hand, push against, flex. We're checking the elbows, flexing and extension, doing supination and pronation. Checking the shoulders and elbows. If you want to go ahead and sit back down, we're going to do your wrists, hands, and fingers. First, we're assessing the range of motion. Bending the hand up and down with the palm. Radial and ulnar. Ulnar and radial. Deviation. Spread your fingers apart. And make a fist. Spread your fingers apart. And then push it back together again. Now make a fist. Then take your thumb finger and tap it to each of your other fingers. You can do that with your other hand, please. Then we're going to be assessing the strength of it. So if you could assessing the strength of the wrist, hands, and fingers. Grip my fingers. Now pull and push. And then spread your fingers apart. I'm going to try and push them together. Now keep them together and spread them apart. Okay, and then so we're going to assess your hips. If you could go ahead and lay back down. Move your feet, yeah, that way. Raise, keeping the other leg straight. Lift that leg up again above you and down, and then again. Now bring your knee to your chest, and again with the other knee. Now we're going to be keeping your legs straight, abducting and adducting and rotating around. Okay, if you could flex your knee inward and then outward and cross your leg with this more flat, and then do it again on the other side. You go ahead and stand back up. And then put your leg like this behind you. Again with the other leg. Okay, you can lay back down. Raise your leg and try to keep me from pushing. And then pull against my hand. Again with this leg, push and pull. Then if you want to sit back up for me. And then cross your leg over. And then again with the other leg. Then bend the knee. Look bent. And then straighten out. Okay. Then pull. And then push. Again. And then we need to do the feet and ankles. Feet to the point your feet upward. Dorsiflexion downward. Plantar flexion. Let me have you do that again. Dorsiflexion, plantar flexion, and then tilt your foot inward and outward. And then again, eversion and inversion, and then rotate your ankle around. Okay, and then you can push down and then pull up. And then you could stand up for one last time and be checking your thoracic and lumbar area. You can stand facing that wall. You could bend using your hips, bend to the left and then to the right. Now bend forward and slowly come up, checking the spine, see if there's scoliosis or any disalignment. Now bend as far backward using your hips as you can. Doing hyperextension, okay? Go ahead and bend forward again, touch your toes. That's extension, and like I said, we just assessed the spine. Thank you for your cooperation throughout the semester. This is the end of the final video.